You are listening to A Path to a New You, a podcast about mental health issues as well as veterans issues. I have not done an episode in over a month. I apologize for that. I try to do one at least one a week. I was supposed to have a guest on. I think it was last week. But that person never showed. And unfortunately, I didn't have anything to ready to discuss for that week. Anyway, this week I want to talk about alcohol and drugs, and overdosing, and then I'm going to talk about facts and have some information about it. Did you know this week is International Overdose Awareness Week, as well as August 31st is International Overdose Awareness Day. So this whole week we have nonprofit organizations um, discuss alcohol use, overdosing, and drug use. There's webinars, there's all kinds of information out there on the internet. So if you're really interested, just let's say Google International Overdose Awareness Week, and a bunch of information will come up, and toolkits and all kinds of great information about that topic will be out on the internet. So if you're interested in looking up more information than what I'm telling about in this episode of this podcast, go for it. I'll also post up some information as well, like links to different um, sites and all that stuff. And I'll will also post statistics and information throughout the week on my personal page, my Facebook page for the my podcast, A Path to New You. I do have a Facebook for that, so if you'd um, like and follow, as well as my private practice as well. I'll get more into that a little bit later on. Anyway, like I mentioned, this week is International Overdose Awareness Week, and August 31st is Overdose International Overdose Awareness Day. Overdose is the leading cause of death for people ages 18 to 45 in America today. More than 100,000 people die of an overdose in the United States each year. It's a lot of people. As of March, as of 2022. Now, that was 2 years ago. That number may have gone up a little bit. Drug overdose deaths increased about 30% in the United States from 2019 to 2020. The COVID-19 pandemic and disruption in access to prevention, treatment, harm reduction, and recovery services likely contributed to this increase. So, again, we had the COVID 19 pandemic where there's not a whole lot of um, treatment. I think there was treatment, but it was all virtual and all that. So, COVID-19 pandemic and the disruption to access of the care and treatment could have contributed to that increase. Recent increases have been largely driven by illicitly manufactured fentanyl and altered forms of fentanyl. Nowadays, anything could be laced with fentanyl. Like there's marijuana out there. You got to be careful. There's marijuana out there that are laced with fentanyl as well. Counties with greater income inequality, a large income group between the rich and poor, had higher rates of overdose deaths. Overdose rates increased by 44% for Black people and 39% for American Indian and Alaskan natives. Most people who died from an overdose had no evidence of substance use treatment before their deaths. Let me repeat that. Most people who died from an overdose had no evidence of substance use treatment before their deaths. Therefore, before their deaths, they didn't receive any treatment of any sort. That's counseling, that's medication treatment, or any of that. No support or anything. So most people who died from an overdose had no evidence of substance use treatment before their deaths. Now, also let me remind you, especially now, even with mental health treatments, there are wait lists. There's a lack of counselors to help to help support. There's a lack of counselors, and there's a lot of people who need support, a lot of people who need therapy, but there just are not enough counselors. So some people just give up and continue their use, and eventually, like I said, like that statement just said, they overdose, and they don't get the treatment. So now, if they had treatment, any sort of treatment or support, that could have been prevented. The Food and Drug Administration has approved several different medications to treat alcohol and opioid use disorders. These medications relieve withdrawal symptoms and psychological cravings that cause chemical imbalances in the body. Medications used for treatment are evidence based treatment options. I'm just going to list off a couple of these medications. The most common one is naltrexone, which blocks the euphoric effects and feelings of intoxication and allows people with alcohol use disorders to reduce alcohol use and to remain motivated to continue to take the medication, stay in treatment, and avoid relapses. So that was a medication that's used to help those who use alcohol, who have an alcohol use disorder. That helps them reduce alcohol use and also helps them remain motivated to continue to take the medication, stay in treatment, and avoid relapses. Another one is I don't know how to pronounce this. Acamprosate, ACAMPROSATE. These are for people in recovery who are no longer drinking alcohol and want to avoid drinking. It works to prevent people from drinking alcohol, but does not prevent withdrawal symptoms after people drink alcohol. The use of this medication typically begins on the fifth day of abstinence. So you'd have to stop drinking for 5 days before you can start using it. And then reaching full effectiveness in 5 to 8 days. And so it takes it's just a lot of a lot of medications. It takes a while for it to start working. This one takes 5 to 8 days before it starts working. And it's taken in tablet form 3 times a day. So again, this is a medication, a comprosate. It's used for people in recovery, so it can help them not drink. Again, in order to use it, you have to have stopped drinking for at least 5 days, and then you'd have to continue taking it every day, 3 times a day, and it starts working about 5 to 8 days after you start taking it. Now, a lot of these medications out there, you have to continue to take it throughout in order for it to work. Now, if you miss a few days here and there, it's going to take longer for that medication to start working. So, as a therapist or even your prescriber, your medical care doctor, your primary care doctor, they usually emphasize you need to take this medication, any type of medication I'm talking about. You need to take the medication every day. You have to take it every day in order for this to work. And again, some of these medications, especially the older medications, they take a few days, maybe even a week to start working. A lot of these newer medications start working right away. These are the newer type. A lot of the older ones take a while for it to start working. No, there's these medications for opioid use disorder. One of them that we all pretty much know about or have heard about is methadone. Methadone reduces opioid cravings and withdrawal and blunts or blocks the effects of opioids. So a lot of people who have used opioids and are um, trying to get off of it and are having withdrawals, they take methadone. They're prescribed methadone. Now, most of these cases, you have to go to a methadone clinic to take it, and someone has to observe you take it. Naltrexone is another one that blocks the euphoric and sedative effects of opioids and prevents feelings of euphoria. That's another common one. There's a few other common medications too, but those are just the ones that I know of, and many of the listeners, many of you probably know of about or have heard of them. Now, a lot of these medications, you take them, but you also need another sort of treatment, and that would be therapy, counseling, and behavioral therapy. Now, under federal law, opioid treatment programs must be able to provide counseling along with medical, vocational, educational, and other assessment and treatment services with the treatment of with taking the medications. So a lot of those opioid treatment facilities, they have a nurse, they have a prescriber that prescribes the medications, and they also have to go through therapy, and that's a federal law. So again, under federal law 42 CRF 8.12, opioid treatment programs must be able to provide counseling along with medical, vocational, educational, and other assessment and treatment services. Regardless of what setting medication is provided, it is more effective when counseling and other services are available to provide patients with a whole person approach and to support their recovery. So, again, let me read that again. Regardless of what medication is provided, it is more effective when counseling and other services are available to provide patients with a whole person approach and to support their recovery. So, what does that mean? Medications are great, but also therapy, going to therapy, that definitely helps. Going to therapy and taking medications, that is what's the word I'm trying to think of? It definitely helps. So you just okay, you can take medications. That's why, for example, let me say this. You got a prescriber or a primary care doctor and they're giving you medications for, let's say, anxiety, right? Or anything like that, or you use substance use or something. You take that and their primary care doctor, prescriber says, "Hey, it'd be great to see if you could see a therapist as well." So then they would connect you to a therapist, and you see a therapist maybe once a week, a couple times a week, and you use therapy, and the therapist um, does this education. They provide resources and information, and they you discuss your situation, they and all that. So therapy works. Medication works, but it works even better if you do medication and counseling at the same time. Your prescriber you'd probably see once every 3 months, right? you check in with your prescriber, person who prescribes you medications. You see that person maybe once every 3 months. You check in, see how things are going, see if you need to up the dose, lower the dose, or take you off the medication. Whereas a therapist, I've talked about this before in one of my other episodes. The therapist, you usually see about once a week, and you see that person weekly, maybe sometimes every other week. You see the person weekly. I think I did talk about that in a different episode. I think my last episode I did, I might have talked about that. So there's also this co-occurring disorders and other health conditions. What is co-occurring disorders? The coexistence of both a substance use disorder and a mental illness is known as a co-occurring disorder. It's common among people with substance use disorders. In addition, individuals may also have other health related conditions such as, for example, HIV, AIDS, hepatitis, or any other health issues. So, someone with a mental health issue and a substance use issue is called a co-occurring disorder. So usually, for example, for the most part, someone has a mental health issue. They think self-medicating with alcohol, drugs, or anything like that will help their situation, which it doesn't, and makes things worse because now you have an addiction, and then you also have your mental health issue, and then that's two things instead of the one thing that you need to work on. So that's a co-occurring disorder. I've worked with clients who have co-occurring disorders, so we've kind of focused on the mental health aspect as well as the substance use aspect, figure out what's going on, find coping skills, trying to find ways where they can help um, prevent the substance use. Yeah, there's a lot that goes into all that. I hope this all makes sense. Some of it might be confusing. If it is confusing, you can always reach me, contact me, and I can actually help kind of explain a little bit better. I think I just talked about this, but again, I want to emphasize it. Research shows that a combination of medication and therapy can successfully treat substance use disorders, and for some medications can help sustain recovery. Medications are also used to prevent or reduce opioid overdose. The ultimate goal is full recovery, including the ability to live a self directed life. This treatment approach has been shown to improve patient survival, increase retention in treatment, decrease illicit opioid use and other criminal activity among people with substance use disorders, increase patients' ability to gain and maintain employment, improve birth outcomes among women who have substance use disorders and are pregnant. So I just talked about this just about a minute ago. Again, I just wanted to read over it. So the combination of medication and therapy can be successfully treat substance use disorders. And for some medications can help sustain recovery. Someone's in recovery, they're doing treatment, they're doing medications, that will definitely help them with their recovery. It also increases their ability to gain and maintain employment. There's research out there that states those who have a substance use disorder or severe substance use disorder, it usually affects their employment. They may get fired or they can't find a job. There's a lot of stuff that goes around to that. Now I kind of want to talk about some facts. I know my episodes are about between 15 to 25 minutes. I just want to talk about some facts that I found. In 2023, provisional data from the Centers of Disease Control and Prevention yielded an estimate of 105,303 drug overdose deaths in the United States, a decrease of 2% from 2022. Two-thirds of these deaths involve synthetic opioids, primarily fentanyl. The United States reported an age adjusted mortality rate of 32.4 per 100,000 population for the 15 to 60-year-old bracket for 2021. And I also read that United States has one of the highest rates of overdose in the world. I saw that in an article somewhere I was reading earlier today. Probably should have printed it out and talked a little more about that. But again, I don't want my episodes to be too long where people are like get bored of it. There's a couple other things I want to talk about. Being in the state of Wisconsin, being from Wisconsin, I know some of my listeners maybe be from like other states or other countries even. I just want to talk a little bit about Wisconsin. So, alcohol consumption in the state of Wisconsin, this was from like 2018. Among adults, the state's rate for binge drinking was 24% in 2018, compared to the national average of 16%. Again, this was 2018. This number's probably might have gone up a little bit since then. In the same year, there were 79,285 alcohol related hospitalizations throughout the state. Further, there were 24,651 DUI arrests. Those are driving under the influence arrests. State of Wisconsin, we call them OWIs, operating while intoxicated. Arrests made throughout the state in 2018. That number has definitely gone up compared to the national average of 15,449 annual DUI arrests made in the United States that year in 2018. Between 2016 and 2017, 60.9% of Wisconsin residents over the age of 12 reported having consumed alcohol in the past month, compared to the national average to 51.2%. Again, this was between 2016 and 2017. That number might have gone up a little bit since then. Illicit illegal drugs use in the state of Wisconsin. Wisconsin residents between the age of 18 and 25 are most likely to demonstrate illegal drug use or dependence. There were 31,066 drug related arrests made in 2018, and 9.8% of the people arrested were juveniles. And data collected between 2015 and 2017, cocaine use in residents 12 years and older rose in the state from 1.4% to 2%. In the time period between 2004 and 2017, the state of Wisconsin saw an increase from 36 counties reporting opioid related deaths to 60 counties. So that almost doubled from 2004 to 2017. Now, that number might have also gone up. I was trying to find more current information on that. I could not. I'm sure it's out there somewhere. There's a lot of more information about overdose use, alcohol use, treatment options, and all kinds of stuff like that. So if you ever Google and you want to look for more information about that, just Google overdose use or alcohol treatments and anything like that, and there will be a lot more stuff um, that pops up to help find information on treatment. If you're looking for treatment, anything like that, you can always ask people too. You can always ask me. I can definitely point you in the right direction. Since I've been in the field and I work in the field, I've been in the field for over 20 years. So I know a little bit about information. I know resources out there, and I'd be glad to help you any way I can. Um, Yeah. So again, I hope you learned something in this episode. And if you have any questions, you can always reach out to me. I do have a Facebook page for this podcast. It's called The Path to Near You. Please like it and follow. I do post information on there. I do post my links to my podcast on there. And sometimes I try to create some sort of discussion on there as well. Um, my podcast is available on most major platforms. You got Spotify, YouTube, um, Google Podcasts, Audible, Amazon Music, Apple Podcasts, pretty much on any major podcast platform out there. Um, I can't get on iHeart for some reason. I don't know, maybe my password. I couldn't remember my password for that, but maybe eventually down the road I might be able to do iHeart on there as well. After listening to my podcast, if you could please review it, rate it, and review it, I'd appreciate it. That helps me with my performance for this podcast. Also, it helps with making my podcast more popular. The more ratings it has, and the higher up it is, the more people see it. Trying to get more people to listen to my podcast. I know so far for Spotify, I have one rate and one comment, I believe, maybe one or two. I'd like everybody to listen and to please rate and share. Click the bell up. If you listen to Spotify, please click that bell so it gives you a notification when I have a new episode up. Please follow as well. I'd really appreciate it. That helps me out. That actually helps with the podcast too. It spreads the podcast out there. More people see it, more people listen to it. I'm trying to educate everyone on mental health issues as well as veterans issues. So this podcast is not just for veterans, it's also for anybody interested in issues for mental health and issues on veterans issues as well. So I've also had a few people say, "Hey, I know this is your podcast is only for veterans." I'm like, "Actually, it's not. It's for everybody. Everybody who's interested in the topic of mental health can listen to it, and everybody will learn something." Anyway, I hope you enjoyed my episode. I know it went a little bit longer than it should. Like I said, most of my podcasts are between 15 to 20 minutes. And until next time, be well, stay safe, take care of yourself. You're listening to A Path to New You.